So this is the sequence of testing for hip flexion, hip abduction, hip extension to look for abnormal movement patterns and muscle firing patterns that will tend to perpetuate asymmetry and like substitution patterns that cause low back pain. And if you keep seeing the same pattern in the patient, you got to look for how to change it. So this is the exam to look for the pattern. So the first thing I look for is hip flexion when the patient's supine. And here, I'm going to point it out to the patient. I'm going to have them put their hands in the front of each of the pelvic bones. So just let your hands rest there. And first, without any cues about how I want them to do it, I'll just ask them to raise, go ahead and raise this leg with your knees straight, and then set it back down. And I'm looking to see if this stays level in this frontal plane. And then go ahead and raise the right leg and back down. So Hamsa passes the test both times. It stays level. So if you take your hands off and I just show, so if I'm looking at the ASIS here, what can happen, say raise your right leg, go ahead and do that. That would be the left, but that's good, that's all right. And then the right is that instead of staying level, it'll drop. And if it does, like if he raises the right leg and this drops, it means that the stabilizing muscles that should have been holding him here are giving way and allowing it to rotate. So the muscles that are rotating to the left would be the stabilizers for right hip flexion. And then for left hip flexion, if this drops, the muscles, and it does like that, then the muscles that are rotating to the right are the ones that aren't kicking in. So these are those lower transversus abdominis fibers and obliques that are in the stabilization in the horizontal plane, so the rotational movement. And they're the first ones to go and the last ones to come back after an injury. So we got three planes, right? We've got flexion, extension, side bending, right and left, and rotation, right and left. And in the stabilizers, it's the rotations that is usually the first to go and the last to come back. And it's for the patient, it's they're unconscious of the fact that they're not stabilizing. So if I find that they are rotating, then what I do is I set them up. I show them how to set up the stabilizing muscles first before they move the limb. So in this case, for hip flexion, I ask Hamsa to push your sacrum just straight back into the table without it tucking up, without tucking. So like just that direction. So you're just pushing back, which fires these muscles right here. It's like what you're doing when you're just about to sit in a chair. You start to move back to sit down, and these are supposed to fire. The second thing I ask is to pull the belly button in, just straight in without moving any bones, and that's the higher fibers of the transversus and obliques. And then the last thing is to contract the front of the pelvic floor, like if you had to pee and you're going to hold it, like 20% of full contraction. Those three things: pelvic floor, sacrum into the table, and belly button toward the spine. And then hold those muscles contracted while you lift the limb. And if that works, that's great. Then you can teach them how to do the exercise with those three things before they lift the limb. If it doesn't, which sometimes they still rotate even with those cues. So then I point out to them, okay, this is the deal. When you raise this leg, you're rotating down. So before you raise the leg, let's just have you try to make your belly button move toward me a little bit. Just twist like that. Or I'll put my hand down here and say, push back into my hand, so that they're rotating prior to raising the limb. And then ask them to raise the limb. And hopefully then they will actually be able to keep it level. Because most people are going to be able to keep it stable if you cue them. Every now and then you've got enough weakness or nerve damage or things like that where they can't. But most of the time people can. So that's hip flexion. And then when you're asking them to raise the limb, the other thing you can talk about is to reach a little bit. Like as they lift the limb, to reach away a little, and you can turn out a little, like that. And then you're firing these muscles as well, and stabilizing here. And thank you, that's good. And the reach, the elongation, is also activates stabilizers. So whenever you're with either limb, any limb, when you're reaching, your stabilizers are going to fire more readily. And the other thing that helps to activate stabilizers in the lower limb is a little bit of flexion of the ankle. So you can have them reach with the heel. I usually do that especially with the sideline exercise, and not as much with flexion and extension, because it's not as crucial, because the more natural movement is a little turning out, a little bit of flexion, and then up. Okay, and so this action we're looking for is going to be hip abduction. So I'm going to monitor here by the quadratus lumborum, and I'm going to see when I ask him what he does with his pelvic bone. So go ahead and lift this leg like a foot and a half or so above, and then back down. And so what I'm looking for is, does he use these muscles, the TFL and the glute medius, or is he substituting and asking for help to lift the limb with some of his paraspinal muscles, like the QL and the other paraspinals? And so if you ask him to go too high, go ahead and go higher this time, then he's automatically going to hike the pelvis to get higher. So I don't really need that much of a range of motion. I'm really looking for that initiation of the movement to find out if he uses his stabilizers to hold steady but not substitute. That's good, thanks. So then if they are hiking and this QL is firing to help the limb come up, then the way I coach that is I ask you to flex your ankle, reach a bit with the heel away until this goes down a little, and then come on back. But don't lift yet, come on back. So when you reach just a little bit, there, that's good. So it's not a huge amount of movement, but it's that elongation. And then same thing, pelvic floor contraction, and pull in the belly button, and then lift the limb. So come on back down. And to get it, so do pelvic floor contraction, pull in the belly button, reach with the heel, those three things, then lift. Come up, breathe in, and as you go back down, breathe out, and rest. Turn it all off, then start over. Pelvic floor, belly button, reach with the heel, breathe in, lift the leg, breathe out, and lower it. And the lowering, one of the metaphors I use in class is to say, think of it as it's like a leaf floating down or a parachuting down. So the downward time, the exhalation time, lasts longer than the lift. That way you're strengthening these muscles eccentrically. They're getting longer while your limb is going down, and they're getting shorter when it goes up. So you want to emphasize eccentric contraction, which helps to stimulate muscles to get stronger. And so that's hip abduction, and then you do both sides. I'll just do this side for the demonstration. And so if I'm giving this exercise to the person, I'll often say, okay, put your hand here and make sure that this doesn't come up towards your shoulder, so that they have their own way of monitoring. Okay? And then in terms of the number of times I have them do it, typically I'll start people with 6 if they have, like, do it 6 twice a day, and at the rate of the breath, and use the breath as the way to count. And then we'll build that up, and when they can do 12 without any muscle fatigue, then they're in pretty good shape. And then if they're an athlete or are pushing for a higher level of function, then you can increase those repetitions. But you don't do it faster, because slow is really key with this, because you want them to be aware exactly of how they're doing it. It's like they're writing a program in their brain that these muscles need to fire first before I move the limb, so that it becomes automatic, so that they don't have to think about it when they're out running or whatever it is they're going to do. All right, now let's do hip extensions. And so if people have a lot of restriction to backward bending in their spine, they may not be able to do it in this position. You might have to use a prop, like put a pillow underneath their pelvis. I'll just show what that looks like. Go ahead and just lift your hips up for a minute. And then go back down over it, which gives them a little more flattening here and helps to have access to using the gluteal muscles easier. I don't think you're going to need that, but I just thought I'd show. And if somebody's really restricted in that direction, I usually have to teach this exercise standing and have them work hip extension from the standing position. But so first, without asking them to do anything special, I just say, please lift this leg a few inches. And I want to see how he does it. Does he use hamstring, glutes, and then does this stay level? And then come on back down. So I want you to put your hands here and kind of get yourself a little more level. Right now you're turned a little bit to that side, so let's go right about there. Can you feel how if that's level?
Mm-hmm.
So push your pubic bone just into the table. Perfect. And see how that makes the gluteals fire. So that's one of the cues I'll use. And then that's also how to stay straight. And then go ahead and lift your left leg. And this should stay level. This should be firing in here, then back down. And then the same with the right. And see, he rotates a little bit when he does that. So this is an example of where he's using these muscles, but he's firing over here to assist. And so it's an uneven use of these muscles, and so he's turning a little bit. So let's do the pubic to the table, pubic bone, and then pull in your tummy, tuck your chin a little, and then this time when you go up, reach away a little bit and see if you can keep this flat. Very nice. And then back down. And see how it's kind of subtle, but you can feel it, right?
Mm-hmm.
Yeah.
Yeah.
And then same over here. Try to keep that flat. Set up the muscles, pelvic floor, pull in the belly button, pubic bone to the table. Reach away a little as you go up. And then back down. So the idea of this is when we, thank you. You can go ahead and sit back up. The idea of this is, you can sit back up if you want. To program the way they're going to use their muscles when they're walking or running. So that natural pattern. So that when they're going through the swinging through the gait, that this part is stable and supporting the limbs, but the limbs are propelling the body forward. And you're not overutilizing or substituting your back muscles to help your limbs move, because the limbs have much stronger muscles. It's more appropriate way to use your body to move without kicking your back in. And it's a cause of a lot of chronic low back pain.
True.
It's good. Thanks.
Thank you.